pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, 3, public comment. We did not have any signatures. 4, approval of the February 11th, 2025 Health and Human Services Committee minutes. Motion by Supervisor Conway, second by Supervisor Cavelli. All in favor, signify by saying aye. Aye. Any opposed? Motion carried. We have 5, policy issues, discussion, and potential committee determination. None. 6, operational functions required by statute, ordinance, resolution, or policy. 6A, discussion and possible action by Health and Human Services Committee. None. 6B, discussion on possible action by Health and Human Services to forward to County Board for consideration. Resolution as to fluoride concentration levels. And with that, this was brought forward to Chair Gibbs and then to me. This was the proper committee to send it to. And per Stacy's request, I would like to turn it over to Vice Chair Arstead.
Would now be the time to make a motion and then discuss?
If you so wish.
I make a motion that we pass this resolution. Marathon County recommends as to water fluoride concentration levels.
Motion on the table
I'll second.
with a second by Supervisor Cavelli. All right, with that, we'll open up discussion. We'll start with Supervisor Arstead.
Fluoridation in drinking water has been fought for many years. I found a document when talking to my mother that my grandfather fought this battle back in 1953. As he was presented his findings to the Minneapolis City Council, his findings included fluoridation takes away from the individual his inherent right to choose and select his own food and drink. Under fluoridation, if you want a glass of pure water, you can't get it. You got to accept the sodium fluoride cocktail in its place or go thirsty. Fluoridation is a disputed subject, even between the learned medicine and professionals. Dentists, doctors, scientists, biochemists disagree as to the possible danger of drinking sodium fluoride, even in small quantities over a long period of time. This was presented 12/21/1953 to the Minneapolis City Council. Jumping 11 years later, there is an article in the Minneapolis Star dated October 19th, 1964. James Kilpatrick wrote an editorial. In his words, government has the power to prevent the spread of communicable disease, but does government have the power to use compulsion in dealing with non-communicable disease? If government can order the lives of people in the non-dangerous, non-contagious area of tooth decay, what limit exists upon the power of the state? No one would object if fluoridation of children's teeth could be managed on a voluntary basis. It's not the fluoride one opposes, for fluoride occurs naturally in hundreds of public water supplies. It is the compulsion, end of quote. Documented studies show that there is more harm to adding fluoride to our water. Our packet includes a history of fluoridation policy over the years dating back to 2017, a safety data sheet on hydrofluorosilicic acid dated 2015, and a list of professionals stating the relationship of fluoride, chloramine, and lead, bad for people, pipes, and planet. On December 3rd, 2024, Drs. Ashley Mullen and Griffin Cole presented to the Wausau Waterworks Committee. During that presentation, Dr. Mullen stated, "The question for policymakers, whether you are comfortable continuing the practice of knowing you cannot reassure the public at this time that fluoride isn't causing brain damage to children." March 9th, 2025, Utah Governor Spencer J. Cox said that he will be signing the Utah bill banning fluoridation statewide. He stated it's got to be a really high bar for me if we are going to require people to be medicated by their government. I do have a WHO chart here, and if you can see it, I can pass it around. It has fluoridation in the red and non-fluoridated countries. And as you see, back in 1975, things were quite high, but it came down. And there's really not much difference between the non-fluoridated countries and the United States. Also, the following fluoridate water in Marathon County: Rothschild Waterworks, Wausau Waterworks, Weston Municipal Utilities, Edgar Waterworks, Athens Waterworks, Cronenwetter Water and Sewer Utility, Marathon City Waterworks, Stanley Waterworks. Those that don't fluoridate their water is Mosinee East System, Mosinee Waterworks, Hatley Waterworks, Schofield Waterworks. I have a list of communities in Wisconsin that do not fluoridate, and they are all highlighted in yellow. The ones that are not highlighted fluoridate. So as you can see, just by looking from wherever you're at, you can see that there's no fluoridation added to waters in the majority of the communities in Wisconsin. The other thing I'm concerned about is the nurse-family partnership. I mean, are we talking to our mothers about fluoridated water and the effects on the children and pregnancy? We have a lead abatement program. It's been proven that fluoridation exasperates lead. So where does that fit into this? And then we also have children's long-term support that we have ongoing. And where does that fit in when IQs are dropping? So with that, those are my comments. These next comments are, Stacy could not be here. Stacy Marash could not be here. So I do have some comments from Stacy. I bring this resolution forward to you today, hoping you will support my effort to safeguard the health of the residents in Marathon County. Excuse me while I get a drink. My mouth is dry. The health of the residents in Marathon County subjected to community fluoridated water without their consent, especially our most vulnerable being pregnant mothers and their children. I, like many of you, grew up drinking water from a private well. My children did the same. So until recently, I was not aware of the dangers and toxic effects of community fluoridated water. We have been told our entire lives that fluoride is good for us and helps prevent cavities. What has been touted as one of the 10 greatest achievements of the 20th century is now being challenged by neurologists, epidemiologists, toxicologists, and dentists. I know I said that word wrong. From around the world. In recent years, studies and meta-analysis are proving ever-increasing evidence of harm for humans and animals, but most alarming on neurodevelopment of infants and children. I first started researching this topic after learning about the 7-year federal court battle involving Food and Water Watch versus the Environmental Protection Agency, EPA. The court ruling was announced by Senior District Judge Edward Chain on September 24th, 2024. He found that fluoridation of water at 0.7 milligrams per liter, the level presently considered optimal in the United States, poses an unreasonable risk of reduced IQ in children. He also stated that the scientific literature in the record provides a high level of certainty that a hazard is present. Fluoride is associated with reduced IQ. The EPA has been ordered to act to strengthen these regulations. This ruling relied heavily on the National Toxicology Programs 2024 monograph, which was released in August of 2024. This report is the most comprehensive, systematic review of existing literature on early life fluoride exposure and child neurodevelopment. It focused on human studies, but also included animal in vitro studies and in vitro studies. 72 of the studies were on fluoride and the effects on IQ. They found there is moderate confidence in the evidence that estimated fluoride exposure is inversely associated with IQ in children. The inverse association between fluoride exposure and children's IQ is relevant to some children living in the United States, including, at a minimum, those living in areas where fluoride in drinking water is known to be at or above 1.5 milligrams per liter. It is plausible that pregnant women and children living in optimally fluoridated communities could have a total fluoride intake at or above the level of those living in a community with water level of 1.5 milligrams per liter. The MTP authors the estimated increase in IQ at the population level can affect people who fall within the high and low ranges of population's IQ distribution. For context, a 5-point decrease in population would nearly double the numbers of people classified as disabled. I've attended NTP monograph webinar given by the Children's Health Protection Advisory Committee, part of the National Institute of Environmental Health Sciences, which is a division of translational toxicology. Dr. Kayla Taylor, a National Institute of Health Sciences epidemiologist, boy, I hope I'm saying that right, and Dr. Andrew Rooney, who works in the National Institute of Health Sciences Toxicology and Risk Assessment, gave the presentation. When speaking about the public health importance, they explained that fetal and developing brains are especially vulnerable to fluoride, and the benefits of fluoride are from topical contact with teeth, and there's no evidence to support benefit from gestational exposure. In addition, formula-fed infants residing in fluoridated communities are at higher risk of fluoride toxicity. They have 3 to 4 times greater exposure to fluoride than adults on a per body weight basis, and a 70-fold higher fluoride intake than exclusively breastfed infants, and they retain more fluoride compared to breastfed infants. During the Q&A phase, a participant asked Dr. Taylor what her recommendation would be to a pregnant friend. Dr. Taylor responded by saying she would recommend purchasing unfluoridated water during her pregnancy. One of the claims we often hear regarding community water fluoridation is that it has reduced dental caries by 25%. In October 2024, the Cochrane Reviews used 22 high-quality studies on children and the benefits of fluoridated water. They found the average benefit was only 1/4 of one baby tooth. Additionally, we could not be sure whether adding fluoride to water reduced tooth decay in children's permanent teeth, and we were unsure whether there were any effects on tooth decay when fluoride is removed from a water supply. According to the CDC, laboratory and epidemiological, research suggests that fluoride prevents dental caries predominantly after eruption of the tooth in the mouth, and its actions primarily are topical for both adults and children. We have a plethora of easily accessible options for topical dental care containing fluoride, such as toothpaste and mouth rinses, as well as bottled water that contains fluoride if people feel they want a supplement to supplement their diet. Fluoride is also found in many common foods we eat, as well as tea and other bottled beverages. So what exactly is being added to our community drinking water? Hydrofluorosilicic acid is an industrial waste product from the phosphate fertilizer industry or from manufacturing aluminum. It is an unprocessed, hazardous waste contaminated with a number of toxins, particularly arsenic and lead. It has never been tested for safety or effectiveness. The EPA does not have empirical scientific data on the effects of fluorosilicic acid or sodium silicofluoride on health and behavior. There's no doubt blinded, randomized clinical trials to prove it actually works. Included in the packet is data sheet provided from Scott Barris, the Water Operations Superintendent from Wausau Water Works. The chemical being added to most community water is hydrofluorosilicic acid. Hydrofluorosilicic acid is a highly toxic chemical and is shown in your packet. There's no data on important toxicological impacts such as germ cell mutagenicity or carcinogenicity, specific target organ, toxicity, and aspiration hazard. Specialized mechanical rooms must be constructed for this toxic chemical, which are costly to build and maintain for water municipalities, creating a long-term economic burden on taxpayers. As shown on the data sheet, this product is water-soluble and may be spread in water systems. It may affect the acidity in water with risk of harmful effects to aquatic organisms. This material should not be allowed to drain into sewers, water supplies, and is considered hazardous chemical as defined by the OSHA Hazard Communication Standard. Surprisingly, it's not regulated by our Safe Drinking Water Act. Many residents use fluoridated water to water their lawns and gardens. This leaches into our groundwater, runs into our sewer system, and is absorbed by plants. Also shown on the data sheet is the hydrofluorosilicic acid contains arsenic. What is the safe level of lead and arsenic in drinking water? The International Journal of Occupational and Environmental Health explained in their 2014 paper, A New Perspective on Metals and Other Contaminants of Fluoridation Chemicals, that each raw additive batch supplied to the water facilities does not come labeled samples. Results show that the metal content varied with the batch, and all hydrofluorosilicic acid samples contained arsenic. A hydrofluorosilicic acid additive contains a surprising amount of aluminum. The conclusion was that such contaminant content creates a regulatory blind spot that jeopardizes any safe use of fluoride additives. A study by Masters and Copeland titled Association of Silicol Fluoride Treated Water with Elevated Blood Lead was published in December 2000. They used 151,000 blood lead tests taken from children ages 0 to 6 living in 105 communities of populations from 15 to 75,000 in New York State. The results showed that average blood levels were significantly higher in children living in communities whose water is treated with silicofluorides. According to the EPA.gov, the EPA and the CDC agree that there's no known safe level of lead in children in a child's blood. Taking action to reduce these exposures can improve outcomes. In the packet, I've included a list of studies regarding fluoride, chloramine, and lead. The primary takeaways from this collection of studies are fluoride is a catalyst or corrosive that impacts lead and other metals. 2, fluoridated water supplies accelerate the deconstruction of plumbing infrastructure and increases blood and tissue lead levels in children. 3, fluoride is an enzyme poison that bioaccumulates in man and environment. Number 4, fluoridated water has an adverse effect on brain development in man and animals and interferes with thyroid hormones. 5, fluoridation for oral health is a false dilemma based on flawed studies and falsified data. Number 6, fluoridation chemicals and chloramine disinfectants are ineffective strategies that worsen public health and damage the environment. Public health officials often claim that $32 per person per year is saved by avoiding cavities due to water fluoridation. If that is accurate, the cost of treating the harms from fluoridation have not been calculated into this figure. It is estimated that our current levels of fluoridation, 0.7 parts per million milliliter, 70 to 87% of kids 12 to 15 have fluorosis. In 2019, the Journal of Dental Research conducted the National Health and Nutritional Survey, and they also found that 87% of 12 to 15-year-olds have fluorosis. Dental fluorosis management techniques include treatments such as bleaching, microabrasion, resin infiltration, veneering, or full coverage of the tooth, such as crowns. Average cost of this type of care ranges between $660 and $12,000 per patient in 2021 dollars. Pit and fissure decay accounts for 85% of decay currently experienced in the United States. This is what occurs in the crevices of tooth's chewing surface. The dental community understands that ingesting fluoride is largely ineffective in preventing that type of decay. Public health officials advocate for community water fluoridation to medically treat those who cannot afford routine dental care. Most U.S. inner cities have fluoridated water, but dental decay is still high in the urban areas. According to data from Head Start, the prevalence of baby bottle tooth decay is about 3 times the national average among poor urban children, even in communities with fluoridated water supply. Fluoride exposure is exacerbated poor nutrition and targeting poor communities with fluoridation compounds the toxic effects. Typically, these populations have deficiencies of calcium, magnesium, vitamin C, and vitamin D. The clinical symptoms mimic arthritis, and the WHO states that early cases of skeletal fluorosis may be misdiagnosed as rheumatoid or osteoarthritis. It is estimated that more than 40 million Americans suffer from arthritis. Studies have proven other long-term effects from fluoride, such as hypothyroidism, crystallization of the pineal gland, ADHD, behavioral issues in children, Alzheimer's, kidney disease, diabetes, reduced IQ, and infertility. In the packet, there's a paper published in August 2024 titled Community Water Fluoridation, a Cost-Benefit Risk to Consideration. The conclusion being, after 80 years for adding fluoride to the community water, the controversy continues due to the current alleged efficacy, lack of individual choice risks, desired dosage, total exposure, jurisdiction, research quality, environmental justice, ethics, alternatives, and lack of cost benefit should all be included and considered. All streams of evidence should be considered for policy evaluation. Okay, here we go. What does this have to do with the policy making the board like Marathon County Board of Supervisors? Objective 3.3 in our strategic plan is to ensure every child makes it to adulthood with health, stability, education, and growth opportunities. First, the 2025 budget for Marathon County's Nurse Family Partnership is $489,000, with $232,000 being personal-related costs. With this knowledge of the harmful effects of fluoridated drinking water, how will the health department ensure fetal development will not be impacted by the neurotoxicity of fluoride? Who will monitor the amount of fluoride ingested by infants requiring formula, or ensure unfluoridated bottled water is being used instead of tap water? What is the funding source for that expenditure? Because currently that is not figured into the budget. Second, our health department is managing the HUD grant the city of Wausau received to do lead assessments. Will they be testing fluoride levels while conducting their lead intervention visits, since it is well established that increased fluoride levels increase blood and tissue lead levels in children? Third, Objective 10.6, ensure the future availability of skilled and flexible workforce prepared to meet the needs of both existing and emerging industries and technologies. The future economic impact of community fluoridation must be taken into account when we consider research based on the IQ effect on wages. With over 59,000 articles published on the subject, about $1,000 per year per IQ point appears to be a well-supported number. Using that data, an IQ loss of 3 points would mean $3,000 lower income per year. Factoring for a total of 40 working years is a loss of $120,000. Please remember the NTP author's statement regarding how a 5-point decrease in population IQ would nearly double the number of people classified as disabled. This comes into play when we consider Objectives 10.6, Strategy B. Seek out additional opportunities to partner with local education providers. If IQ levels and test scores continue to drop, this will have a detrimental economic impact in the future for Marathon County. If we truly seek to make Marathon County the best place to live, work, raise a family, as well as be the safest, healthiest, most prosperous county in the state of Wisconsin, we need to take measures to protect all of our citizens and ensure positive outcomes for pregnant mothers and children. Lastly, water departments can control the concentration of fluorosilicic acid in the drinking water, but they cannot control the dose. The only purpose of water fluoridation is for medical treatment. People have the right to bodily autonomy, and this practice infringes upon that right. Therefore, I propose that this board recommend that water municipalities in Marathon County follow the EPA's default standard, which is for there to be a factor of 10 between the hazard level and exposure level. According to the NTP report, the hazard to a child IQ exists at 1.5 milligrams per liter. So using their default standard, the fluoride concentration in drinking water would need to be 0.15 milligrams per liter or lower to provide enough of a margin of safety to protect child IQ. Some municipalities have naturally occurring fluoride, such as Wausau, whose level is between 0.06 and 0.06 and 0.09 milligrams per liter. The addition of hydrofluorosilic can be adjusted accordingly, or better yet, left out altogether. I ask you to please join me in my efforts to safeguard the health of all residents in Marathon County by supporting this resolution to recommend water municipalities follow the EPA default standard. Thank you. And that was from Supervisor Stacy Marash.
All right, thank you. Anybody else? Go ahead, Supervisor Covelli.
Thank you, Mr. Chair. So I do support this resolution. After more than 10 years of my research in fluoride, I was never a fan of adding any chemicals or toxic substances to our water supply. And I do believe in the rights and healthcare freedoms of citizens to be able to make that choice if they want to add it to their water supply. I don't think it's I don't think it's ever been communicated to me when I lived in the city of Wausau that the fluoride in the water was toxic or a toxic chemical. And I believe that informed consent is important to our society. And without that informed consent, what are we exposing our children and ourselves to? So I think it's important that we really take a good look at this resolution because I think it's well written and I think it addresses the toxicity of this chemical that we're adding to our water. And I believe that the courts back in September of 2024 made the right decision for the EPA to review this. So, in that light, I'll be supporting this resolution. So thank you.
Supervisor Conway or Supervisor Foote, doesn't matter.
I would just like to say that if we already have .06 and .09 naturally occurring in the water, why add any at all? I would be, I don't know that this is how you do an amendment to the amendment. I would change that to, let's stop adding this. I don't understand why we're adding this when everyone can add it to themselves at home if they need to, or with a medical advisor saying that they need it. Do I have to do something to
If
make
you
an
want to
amendment
make an
the
amendment, you would have to make an amendment.
Okay, so I would amend, I would change the fluoridation level to that, how would I say that? So I would recommend that Marathon County does not add any more fluoride to their water. And, but I also am not saying that they have to then take out the fluoride that's naturally occurring. You see what I'm saying? I don't know how to say that. So
Just take out what's added.
take out any additional fluoride and leave it alone. I don't-
Just give me a brief second here to make sure we have this down correctly. Did you kind of understand that, Kim, how she wanted that? You got it? All right, now then do we have a second to the motion, first of all? Second by Supervisor Arstead. So we'll be discussing now the amendment. Anyone want to discuss the amendment? Okay, if not, we would vote on the amendment right now to add the amendment. A yes would be change the wording per the amendment, and a vote no, would be going back to the original item. So, with that, I guess, Mike, can I do a hand vote instead of the yea or nay? Is that in order at this point?
You could ask for a roll call or.
Let's do a roll call vote. We'll do a roll call vote. All right.
All right, Boots,
Nay.
Arstead,
Yes.
Covelli,
Yes.
Conway. No. Foote,
Yes?
Radke. No. Zhang,
No.
All right, so we're back to the original document as spelled out resolution for the fluoride concentration levels. Any conversation on that? Supervisor Conway?
Okay, I'm not a scientist, so I do remember my high school scientific method, but I'm not going to speak to the points here. I'm also not a dentist, but I called my dentist to ask him, like, because I saw this was on the agenda, and it's a fluoride thing, that's dentistry, and asked him if there was anything to this. And he's a very down-to-earth guy. I've been going to him 25 years probably, and he said it was safe and effective. There's no reason not to have it, put it that way. But I think more importantly, the county is not the same as towns, villages, and cities. Your list where some fluoridate, some don't, that's up to them. They have local control. County, we're an arm of the state, so I don't think this is our particular fish to fry. So I would not be supporting this.
Go ahead, Supervisor Radke.
Yeah, I'm no scientist either, and I think we should let that up to the local municipalities, and I also think it's more on the state and national level. They can look into that. I just don't think we should be telling other municipalities what to do. I also, I'll be voting no on it.
Go ahead.
I wonder what our health department thinks of this, or what their opinion would be on it also.
Do we have anyone from the health department as a representative here today?
We do have Amanda Ostrowski, who's our interim health officer here, from the health department. I will say this as your administrator. This is a topic that is of great discussion, as was laid out in the resolution. Amanda also is not a dentist or an expert, neither am I. I can try to read studies and give you opinions, but respectfully, if there's a desire for more information, staff will we will do our best to bring you an expert. But I'm highly uncomfortable waiting in an area where, quite honestly, I don't have that expertise. And I would ask that my staff take that same approach.
Okay. Go ahead, Supervisor Cavelli.
Thank you, Mr. Chair. So I have done a lot of research in this over the last 10 or 15 years, and it is a toxic substance. And I don't think we should be adding it in our water. It is naturally occurring. I think the public should be informed of these studies that Vice Chair Arstead just read. I have read them. I have attended conferences on fluoride. It's not a good substance to put in our water. It affects pipes, as some of the studies in here showed, and it will increase diseases like kidney disease, liver disease. It affects strokes. You could have strokes based off of your consumption. There are a lot of studies out there that show the health effects that this causes far outweigh the benefits. The one thing in the resolution, it does say that now therefore be it resolved, the Marathon County Board of Supervisors hereby expresses its recommendation that water municipalities in Marathon County follow the EPA default standard. So we're saying that that we recommend that the municipalities in Marathon County follow the EPA standard. That's what we're saying in this resolution. We're not saying they have to put fluoride in water or not put fluoride in water. We're recommending that they follow the EPA standards, which the court in 2024 determined that the current recommendations were toxic. That's what we're saying in this resolution. So thank you.
Supervisor Lemmer.
Thank you, Mr. Chair. I am not a scientist either. There are so many other things I wish we would focus on. Our strategic plan has plenty to do. However, I will say that this is a emerging issue, and maybe it does merit some discussion, but I think we do need experts at the table. I might disagree a little bit with the administrator. I think we do have an expert who has studied and knows how to get that information. But that said, this resolution seems a little bit like a solution looking for a problem. I think scientists should be making this decision and proposing these changes, not politicians. I'm the daughter of a dentist, so fluoride is a passion project of mine. I grew up with fluoride, and I too called my dentist because I thought, well, I mean, that was a long time ago when I was schooled on fluoride with my dad encouraging us to brush and floss daily. And my dentist said they follow the ADA's recommendation. So I looked up the ADA's recommendation, and sure enough, there's a letter that they sent January of 2025 asking the EPA to provide some clarity, because there was not clarity in this letter. They support continuing using fluoride in water, and it was signed on by 13 different dentist associations, things like the American Academy of Pediatric Dentistry, the American Association of Dental, Oral, and Craniofacial Research. I mean, there's 13 of them, plus fluoride in municipal water is supported by the American Medical Association, the American Academy of Pediatrics, the CDC, the WHO, and the American College of Obstetricians and Gynecologists. So these are the professional scientific organizations that I think we should be listening to. I also called Eric Lindman at Wausau because I'm District 2 and that's my jurisdiction. And he said that the water utility uses corrosion control within the water distribution system to mitigate lead and copper from leaching into the drinking water. Fluoride does not affect the corrosion control, so it has not been an issue. So all the leaching that's been talked about with lead poisoning and it bringing it out, I have all the confidence in the world of our Wausau municipal system. Eric said they're doing everything they can. He also said they monitor, I'm quoting from his email, city fluoride levels are maintained at a 0.7, which is the recommended range, where the recommended range is 0.6 to 0.8, optimal level being 0.7. He said we test fluoride levels daily at the treatment plant and in the distribution system. In addition, we do additional 2 tests through the week in the distribution system at various locations approved by the DNR. We are confident our fluoride numbers are accurate and we maintain the 0.7 level. He said at the treatment plant where they feed the fluoride, we have a backup safety control to prevent any overfeeding of chemical. All of our chemicals are flow-paced, which means the chemical feeds the proper amount based on the amount of water flow in the pipe. If the flow stops in the pipe, then the chemical feed stops, which prevents overfeeding of any chemical. We also have volume checks in our control system that verifies the amount of water being pumped and the amount of chemical being used throughout the day. Any discrepancies to the chemical feed shuts down and triggers an alarm. So Wausau is paying attention to this, and they follow the EPA guidelines already. I don't know if other municipalities do, but I would encourage you to reach out to them. I also would encourage you to fact check the information in the packet, because much of that information has been misquoted, cherry-picked, etc. And so when I was teaching 8th grade English, I would tell my kids, go to the fact-checking sites, Snopes, factcheck.org. There's many of them that colleges encourage their students to use as well, and ask those questions there before assuming that some of these studies are legit, because meta-analysis can be deceiving. So, thank you.
Further, go ahead. Supervisor Foot.
Well, to your point, also, the amendment that we're talking about is not my amendment, the one that said 0. This is the amendment that says the lowest level that the EPA requires, or not requires, recommends, I'm sorry. So I would like to err on the side of the lowest that the EPA recommends. I have a personal problem. My daughter had an overabundance of fluoride, and her teeth are marked with white, the fluoridisis, or whatever it's called. Hopefully, it's not on her bones. It's not like we can look and see, but it's just on her teeth. And so I feel strongly that we shouldn't accidentally overdose our kids. And just because I didn't have that experience doesn't mean that nobody had that experience, i.e. my child did have it. Some people are more susceptible to stuff, and I just feel like why? This is a recommendation. This is kind of the first step for the public to even know, oh, we have fluoride in our water? Like, who knew? The public doesn't think about something until something goes wrong, right? And I just think it doesn't hurt to get this out there to let people know what's going on. And the water department can lower the amount they put in easily.
Supervisor Cavelli.
Thank you, Mr. Chair. So that 7-year court case was decided on that there was no study ever done on brain IQ. The EPA did not appeal the judge's decision. So I think this resolution is in line with what the EPA is doing. And I think that when you talk about ingesting fluoride versus topical, they're different. So the levels that we recommend in here, and remember, it's a recommendation for the resolution, is 0.15, not 0.7. So those are the facts.
Supervisor Conway.
Just as an FYI, that court case's decision is on the frequently asked questions page for the EPA, if you want to check it out.
All right, well, I was going to say a couple brief things, I guess, before we go to a vote, unless somebody else wanted to say some things. So I don't know much about fluoride. I'm trying to get versed in the last couple of weeks after Stacy came forward with this. But one of the first things when I pulled it up, it says, fluoride is a mineral that has been added to public water supplies in many countries to help prevent tooth decay. The decision to remove fluoride from water is a personal one, and there is no consensus at all on its health benefits or risks. That's AI, obviously. Now, I'm just pulling up first thing I saw. I know this is a contentious thing, especially when we were talking about fluoride. This is on the national level even, let's be honest. We're kind of saying this is where Marathon County stands as our resolution, and I don't think as a full board of 38 members, we're all on this, would be the same. Would I want fluoride in my water? I currently don't. I live in the country. I do have a reverse osmosis because I do have nitrates in my home, so I had to get a reverse osmosis. Some of the things I wanted to question, can you use reverse osmosis for fluoride? It says you can, and this, I didn't get really into depth of what you can do to get fluoride out of your system. But I'm also a very, very big proponent of local control, 100%. Town of Texas, Town of Wausau, who I represent, I can tell you right now, Town of Texas has their own zoning because we don't want the county to control us. It's just how it works. So I find myself, I would be going against my own principles as far as local control, saying something like this, because we're telling municipalities what they should do. Mosinese already made a decision, we're not going to take it out of our water. Or we are going to take it out. We're not going to add it. We're going to have it. Marathon City is saying we're going to add it. Wausau is saying they are. I don't like trying to trump a municipality as a county. I don't like when the state tries to trump us and what they think we should be doing. I don't like when Marathon County tells my township what I should be doing. That's how I stand on this. I can honestly say it a second time. I wouldn't want fluoride in mine, just with the brief things I've read, but I also have other things I do with fluoride and things like that in the household with kids. So that's just where I stand, and that's how I see this subject. Resolutions have their place, and I think this is a resolution in my mind. And don't get me wrong, I know Stacy did the research. I know that everybody in here did the research on this to see their own point of view. But I think it's a point of view that maybe doesn't represent the entire county board of Marathon County, but certain people that we don't want this in there. I wouldn't want it. Some people maybe do. So that's where I stand on that. So with that, I still open it up to further questions or comments. And we will do a roll call vote as well on this, please.
All right, Boots,
Nay.
Arstead,
Aye.
Cavelli,
Aye.
Conway, Foot,
Yes.
Radke, Zhang.
No.
Thank you.
All right, thank you. Going to move to 7A, update from the Marathon County Special Education on Birth to 3 program. Turn it over to Administrator Leonard.
We actually have Kelly Capitz here from Marathon County Special Education to give you an update. Kelly, you want to come up? Do you have? Okay.
I don't know because I popped over here for Kelly.
All right, I apologize. In the packet from your meeting that was supposed to be scheduled last month, there is a presentation from Kelly. And just for grounding again, to get everyone on the same page, Marathon County Special Education, despite the name, is not a direct Marathon County department. That said, they have been a longstanding partner for Marathon County. And one of the areas in which they do deliver services to the residents, certain residents of Marathon County, and in this instance, to also Lincoln and Langlade County, is in the Birth to 3 program, which is a mandated program from the state for counties to deliver. The way we deliver that service here in Marathon County is through a kind of a series of partnerships, first with North Central Healthcare, but then ultimately now with Marathon County Special Education. And they can explain to you, their main office is located on our Lakeview campus, so right next to the health department and social services, and now a series of other departments as well as North Central. So with that, I will kick it over to Kelly. Feel free to just scroll.
All right. Thank you. Thank you so much for having us. As Len said, I'm Kelly Capitz. I'm the director at Marathon County Special Ed. And as Lance said, we are a department, but not. So we're in name only. And I'm joined today by Tanya Carter, who is actually our Birth to 3 manager. So we're just going to take a very brief moment to explain a little bit about our services. First of all, Marathon County Special Ed, we are a county disabilities education board. We used to be directly under the umbrella of the county, and then in 1986, we became our own separate entity. And so we have a long-standing tradition of being part of the county, but in unique and varied ways. And so about 6 years ago, the Healthcare Center, which previously had hosted the Birth to 3 program, approached us and said, we think that this program would be a perfect fit for you. And it is. Special education by law is working with kids 3 through 21, and Birth to 3 is a perfect companion to us under the federal and state legislation, which works with kids that are 0 to 3. And we do, as Lance said, we provide the services directly to not only Marathon, but Lincoln and Langlade counties as well. And the fit with Birth to 3 is perfect because our mission overall is to provide high-quality services to families and children now 0 to 21. So what is Birth to Three? As Lance mentioned, Birth to Three is a federally required program, and it is specifically designated to work with kids who have a designation of a developmental disability. And our work is codified both in federal and state legislation, and it's been in operation since 1986. I'm going to let Tanya give you a little more detail.
Thank you. Thanks, Kelly. Scroll to the next slide. Kelly already had referenced that our sole purpose is to enhance the learning and growth of children that do have those developmental delays. We want them to reach their milestones, and we do that by providing intervention services. We also have a large partnership with their families. The families are a large component. We do, when appropriate, at the age of 3, help bridge the gap between home-based services and school-based services, which is another component to why our relationship is so beautiful. Across all 3 counties, we do work with 19 different school districts, so we have our work cut out for us with knowing the ins and outs. One thing that many people don't realize about Birth to Three, because we are federally and state mandated, is that it is voluntary. It's a voluntary program, and parents may choose to accept services, they can deny services, or they can seek alternative services through the medical community. Some families may choose to just move forward and have their child evaluated just to kind of see how they compare to same-age peers. Some may want to try the wait and see approach, and others may choose to receive services through other alternatives like an outpatient medical facility. You can see on this next slide a 5-year trend of children and families served across all 3 of our counties has been on a steady incline. Currently, or in 2024, we were serving 175 families across all 3 counties. This is our team. We are housed right here in Wausau. We have 15 total staff members that travel to homes across all 3 counties. Certainly, many of them are geographically based, but our team makes up primarily of speech and language pathologists, physical therapists, occupational therapists, service coordinators. We have some office staff, and then, of course, myself.
So how do we exist? We exist in 3 different ways. We are funded through 3 different revenue sources. The first is through a federal grant, and that federal grant flows down to the state, and then in our case, the North Central Healthcare system manages this grant for us. It's been a pretty hold steady amount. The second way is through each of the individual participating counties paying their fair share or maintenance of effort amount to support the ongoing services. And as you can see, over the last 5 years, it's been at a hold steady amount. And then finally, as we said, it's a voluntary service as parents can choose to accept or not, but it is not a free service. And so private insurance or Medicaid are also billed. And so just to give you perspective, the grant represents about 34% of our funding. The funding through the counties is 45% of our funding, and then the private payer Medicaid portion is 21%. And as I mentioned, we are a maintenance of effort situation, which means that if a county pays, just for round numbers, $500,000 this year, they must maintain their fiscal effort the following year and in an ongoing way. The other thing is that there is oversight to us. We are reviewed, and it is through a statewide review that is generationally and operationally managed by the federal government. But the 2 ways that we are given oversight is 1, through statewide compliance. And the best way to articulate this is that it's, did we follow all the processes that we were supposed to do? Did we meet our timelines? Did we do all of the paperwork, process, and procedure in the proper way? The second way is through a quality review, which for us is really where the rubber hits the road. And this is whether or not kids are growing, families are successful in supporting their students. And what we're happy to report is all 3 counties do meet the expectations for both the quality and the compliance review.
And while statewide monitoring is very important, we also really care about what our families think about us. And so twice a year, we do send out family satisfaction surveys. And you can see here on the screen that our results are overwhelmingly that families feel that the Birth to Three program has made a positive impact on their child and family's day-to-day life, and that they would also recommend our program to others. And each year, we also talk about our goals. Our goals for the 25-26 year is to continue to provide high-quality services. We want to continue to improve outcomes for all eligible children, enhance family engagement and resource connection, and also help support our team with professional development. And that concludes our presentation about the Birth to Three program. Does anybody have any questions for us?
Supervisor Conway.
Not a question, but a comment. My third kid, Will, he had apraxia of speech. I had no idea what that was. It's where they don't know how to talk yet, and they should. So your organization was very helpful. He's now 16. I can't get him to shut up. So thank you very much for what you've been doing.
Thank you. Thank you for those comments.
Any other questions? Wonderful. Well, thank you so much for I'm sorry.
I too have a grandchild in your program, and he has Gestalt. And it's interesting to know that for something with that's not well known, that you have people helping him through the speech with Gestalt.
Thank you.
So thank you.
All right, thank you.
Thank you so much.
Thank you. Thanks for having us.
All right, we'll move to 7B, update from Social Services Director on Children's Long-Term Support wish list. Is that, should put on my glasses, wait list, remediation plan, sorry.
You'd like.
Sorry. Been a long day.
That is okay. Good afternoon. I just have a brief update for you all. I think this committee is well aware of what children's long-term support is and the wait list that we have had to, not had to maintain, but have been maintaining, and what our requirements are. We had shared with you in the fall of '23 a request for additional CLTS social worker positions so that we were able to eliminate our wait list, knowing that corrective action plans were coming to the counties. And so we're very thankful to you all for giving us those positions, and those have really helped to move us along eliminating our wait list. The presentation I had for you in March is really no longer applicable, which is why I'm not giving it today, because our numbers are different. We currently only have 10 children on the wait list, which is a huge, huge decrease from where we were. And as of April, we will be enrolling children within the timeline that we are required to do so. And so we did submit our corrective action plan to the state on March 6th. They have 30 days, so it'll be April 6th, to report back if they approve our corrective action plan. And essentially within that, we had to talk about what the underlying reasons why we had a wait list were and what our plan was to correct that. And so a big part of our plan is what you all approved was those additional positions. We have hired 3 of those 6 additional social work positions, and we are going to pause on hiring additional social work positions right now and see where our wait list brings us. Again, we are down to 10 in April. We are anticipating enrollment in alignment with the timelines that we're supposed to have. And we're seeing a little bit of an anomaly right now in 2025 with lower referrals than we have historically seen, and less children who are referred being functionally eligible. Historically, that's been 90%, and we're seeing a decrease in that as well. So the reason for that, I don't know for sure, but we're seeing that decrease, and so we don't want to hire additional staff unless we really have that business need to do so. If our referrals had stayed the same as they were projecting through '24, we did have projections that additional CLTS positions would have been needed in April of '26, because that's when all of our additional staff would have had what we would call a full caseload of 38 families that they're serving. But again, due to a little bit of the decline in referrals and catching up on our wait list, we're going to hold off off on hiring those 3 additional staff. But we should be hearing in the next few days from the state if they approve our plan, or if we need to make any additional amendments. But at this point, we are projecting in the right way with only 10 on our wait list and meeting state compliance requirements, federal state compliance, by April. Any questions?
Questions? All right. Well, thank you very much for the update.
Thank you.
All right, we'll move to 7C, strategic plan review and updates. We have Vice Chair Dickinson on the line, and he will run us through what he's got. So here you go, Mr. Dickinson.
I am here. I hope you can hear me okay.
Yep.
Thank you. I apologize for not being there in person. We had an electrical issue in the house, and I couldn't be in person. So really what we're looking for is the current strategic plan was passed by the board in 2018. We had a COVID issue, obviously, so there was a revision and extension that was completed on the strategic plan in 2023 with the outcome measures that were to last through 2024. So really, this isn't a discussion on extending anything or making modifications. It's really just a discussion on the outcome measures, which you have 3 objectives and 9 outcome measures to see if those were met, which would then lead into a discussion with the new comprehensive plan, which is being worked on, which would lead to a new strategic plan next year. So really, it's for your committee to discuss these items. Department heads who are there can comment on whether they were achieved or not. And then the general idea is that all standing committees would give a report to the full county board after all standing committees have commented. So I will give that to you, Chair Boots, to kind of step through those objectives.
So just real quick, Chris, then, so are you foreseeing like me doing a report, let's say at a time to be determined at the full board? Is that what you're asking? Is the board chair of each standing committee to make a report on what they've discussed as it relates to the strategic plan?
Yep. So you have objective 3.3, 3.7, and 7.2 for HHS.
Yep.
And then you have those outcomes that are associated with those. So really what I'm looking for is, did we meet those goals? So for example, objective 3.3 outcome 1 is achieving a graduation rate.
Yep.
Correct. Have we hit that?
How we did. Okay.
So really it's just stepping through the outcome measures.
Okay.
In this meeting, and then I would take that data and just wrap it up in a short briefing to the entire county board at some point, if that makes sense.
Yeah, I think that makes sense. Do I have questions from the other members, what he's looking for? I think what we'll possibly do, and I'll talk with Administrator Leonard, and we'll probably, a next meeting. You want to start going? Yeah, we can. You guys want to start going through some now? Lance is saying we might as well. And we got a long meeting because we're going to be going down to the VA too. So. We're going to save you time. Aaron's on. Is it? Yeah, the VA is. Okay. All right, we're going to go through it now.
So good afternoon, everybody. I'll get you started, but your experts in the room are people other than me to talk through kind of what we've done here. But as Vice Chair Dickinson referenced, this committee, just to ground everyone again, going back to 2018, seems like so long ago. The board did adopt the strategic plan, which is on the website, and you've made there have been a number of updates to it in terms of not only informational updates, but also some substantive updates by the board relative to the strategies, as well as some of the outcome measures. So up on the screen right now, this is pulled from, straight from the website, but it is the 2023-2024 revision and extension document that is available. So as the vice chair referenced, this committee is tasked as the lead committee with respect to objective 3.3, 3.7, and 7.2. So based on the direction from Vice Chair Dickinson, we pulled together just at a high level some of the outcome information, and we'll share that with you today. And if you have questions, happy to try to answer them or to tell you that we will come back with information. So on objective 3.3, ensure that every person makes it to adulthood with health, stability, and growth opportunities. There were 3 outcome measures that the board deemed appropriate to assess whether or not the county was making movement there. And I will just say a number of these we really don't influence in a very direct way. And I think outcome measure number 1 is an example of that. That outcome measure is by December 31st, 2024, there will be an increase in graduation rates to 93% or above in Marathon County. The data that we have on that, and again, we don't directly influence that. We do a small amount of education out at our juvenile detention center. We are mandated, state law mandates that we provide education services or facilitate education services to the juveniles that we have in our care. But we do have the opportunity to influence that in a number of ways through partnerships with schools and our work with social services and other departments. So here is from Marathon County Pulse. I apologize that my email is popping up, all my reminders. But high school graduation rates through Marathon County Pulse, it does look as though it moved from 93% in the prior year reporting, which I believe was 2021, to in the 2022-2023, that's the most updated data we have, it did increase to 94.5% based on information from the Department of Public Instruction, which is, again, I think a good thing based on the measure, but that is objective 3.3 outcome measure number 1. Outcome measure number 2 relates to, by the end of 2024, having out-of-home placement days decrease with an emphasis on reducing the most restrictive and expensive placement types in favor of more family-like placement settings. And Krista Jensen, our Director of Social Services, is here to kind of give you at a high level kind of what that has looked like over the last several years. If you've probably heard us use the phrase Family First or Family First Preventative Services Act. And that certainly correlates to this, but I'll let Krista take it from here on this one.
Thank you. Yeah, at a really high level, overall, just from 23 to 24, we saw an 8% decrease in out-of-home care utilization. We have we call it a monopoly report, that shows our out-of-home placements from 2011 to current. And our 10-year average is 155 kids that we typically see right now. In 2024, we saw 121. So we're significantly under what our 10-year average is. There's a lot of reasons for that, some of which you all know, and Administrator Leonard mentioned, is the Family First Preventative Services Act. Family Keys has been a substantial player in that, and then just all of the community resources and services that we have to provide for our families to try to help them stay safely together instead of having to separate them. So overall, we've seen an 8% decrease in our out-of-home care. Particularly, we have seen a 40% increase in our relative placements from 23 to 24. And therefore a decrease in our non-relative foster homes by 11% just in that year. So that has been a really significant focus for us. We've also seen an increase in our court-ordered kinship care, so relative placements by 13.5% almost. So both really showing a lot of progress towards family care and keeping children with relatives whenever possible. We have seen a decrease in the utilization of higher level of care placements, so residential care facilities and group homes. We saw a 32-day or 9% decrease in our use of residential care facilities. And then we did not have any placements in a juvenile correctional facility in 2024 at all, where we did have one in 2023. And our treatment foster home placements have also decreased by 20%. And our group home placements have decreased by 12%. So overall, a really strong decrease in utilization of more restrictive placements and a pretty significant increase in utilization of relatives and the least restrictive level of care that we are able to provide. Any questions on those?
Thanks, Krista. So that's a product of, as Krista alluded to, there's a lot of work that's been done for years. I mean, I remember working with Krista in a different position in the county, and, you know, it really is a change in mindset to look at things differently. What supports can we bring to the family to do the best job we can to maintain that family unit, if at all possible, in a safe way. But even then, if we do need to place that child, to do it in a way that is the least restrictive and most open to ongoing family contact. So hope that's an overview. That's been a goal on the strategic plan for a long time. So I think staff have made strong progress there in light of the board's directive.
Administrator Leonard, I would just note one additional thing. I think it's important, our detention days. So there's a shelter and then there's secure detention. In the last year, we did see an increase in our detention days because, as this board is aware, our shelter did close. And so there were some youth who maybe would have historically gone to shelter that ended up going to a secure detention facility because Marathon County didn't have one in 2023. But now that we have our Youth Opportunity Center, it'll be really interesting to see how that data changes in the forward years. But that is a change that we saw sort of on the opposite side, but it was because we lost a lower level of service.
All right. If there's not any questions, we can move on to outcome measure 3, which was by the end of 2024, the capacity to deliver affordable, high-quality childcare to children in Marathon County will increase. So again, this was one of the areas where the board actually added an outcome measure. And the board added some strategies relative to childcare, and the Extension Education Economic Development Committee, just to, again, ground everyone, had a number of conversations about that. The county ultimately just last year did approve, I believe it was in September, the allocation of a significant amount of ARPA funds to try to bolster the ability of childcare providers to fill slots. Again, not an area where the county we don't directly provide childcare. But we do certainly, through partnerships and based on the board's allocation of funding, have the opportunity to influence that. So just if you want to look, there's a lot of data on, again, Marathon County Pulse about childcare capacity. I just pulled up the total capacity of childcare providers within Marathon County, and you'll see this is not new to you. This was presented in a lot of the conversations that we had with child caring and during the board's consideration of providing that ARPA funding. Those slots do continue to drop based on, quite simply, the workforce challenges we see throughout not only Marathon County, the state, but also nationally, and the difficult business, I think, certainly I'm not mischaracterizing based on my limited understanding, but the business model of childcare is very, very difficult. So those slots continue to, at this point, be in steady decline. I did speak with Kelly from Child Caring, I believe it was last week or the week before. They do have some individuals going through that education program. It'll be interesting to see, kind of similar to what Krista just alluded to with the previous indicator. Does the increase of individuals going through that program, those new providers, does that actually start to turn that curve? Certainly too early to tell, but that's where we're at with respect to that specific outcome measure. Any questions, thoughts, or anybody, if you guys want to add something?
Add, Administrator Leonard, a reminder that childcare certification did used to be under social services, and for this year, 2025, we did transition that to childcare, and so they will be doing the childcare certification services. They do have scheduled outreach events. They are going to be at the Job Center on April 9th and then quarterly after that, so they are doing a lot of efforts in attempt to recruit individuals, and as you mentioned, that the resolution that this board helped to pass was, hopefully, will be very impactful for our child care numbers.
All right. Any questions? A couple of questions. Go ahead.
Thank you, Administrator Leonard. Do you know what the gap is right now for, how many slots are out there versus how many are needed?
I don't off the top of my head. We can go back and look.
Pulse report may have that.
Yeah.
And follow-up to that is do you know what the impact of the dollars that we allocated have on that gap?
No, I talked to Kelly. She wasn't ready to provide any substantive update other than she said they do have some more people going through that program right now. But we did just reach out to see, under the contract that we drafted based on the board action, it does require her to give those updates. So in the near future, I would envision Kelly showing up, but I don't have a good way to quantify that right now. I will look into what is if we have data on the gap between available slots and need.
I think that will give us a good idea on the impact of the dollars that we provided for that to see if that made a difference. Thank you.
I think Supervisor Arstead had her hand.
Supervisor Arstead?
Oh, sorry. Yeah, sorry, the monitor. Oh, thank you. I appreciate the help. So then, if there's nothing else on that, we'll go to objective 3.7, ensure that every person has local access to effective mental health treatment. Again, this committee is the lead, the department lead as the last objective. Social services was identified from the staff perspective as the lead. Here we have the health department with also some support from North Central Healthcare. They were identified as the primary departments. We'll go through relatively quickly some of the outcome data, but the first outcome measure was by December 31st, 2024, the number of Chapter 5115 emergency detentions in Marathon County will decrease. And I know Amanda pulled a lot of information, and I'm just throwing up an email that she sent me, and I appreciate that with the late notice to get this information, again, off of Marathon County Pulse, as I understand it. But you can see just from what's up on the screen, we have seen a lot of positive work in this area. We've gone from, if you go back to 2016, 482 emergency detentions. It's pretty consistent trend over time. We've had some ups and downs, of course, but it's been consistently moving down. And in 2023, we ended the year with 225 emergency detentions. So for context, what an emergency detention is, and I'll have Corp Counsel correct any misstatements I offer here, but if we have contact either self-initiated or through North Central, through the Crisis Center, or through law enforcement with an individual who's deemed to be a danger to themselves or others, with a mental health condition, and they're sufficiently a danger to themselves or others, we can proceed with an emergency detention based on evaluation under Wisconsin statutes. That goes through in Marathon County. We end up having that evaluation done by North Central Healthcare, and the individual can be detained in our inpatient hospital. Ultimately, those cases then are handled by our Corporation Counsel's office through the Marathon County Circuit Court. Close enough, Mike?
That was good enough for me.
Okay, perfect. And why that's important is, first of all, I mean, again, it's detaining an individual against their will, which we much prefer, similar to what Krista talked to, getting people treatment at a time when they're more amenable and it doesn't require that deprivation of liberty. So that has been the goal. How do we provide those supports? Very similar to what Krista talked about. How do we provide those supports in the community and make treatment available? So you'll see pretty solid progress, I think. Anything you wanted to add on that, Amanda or Mike?
Nope.
A big part of that, if you want some initiatives, I mean, it's been a focus of our Criminal Justice Coordinating Council because, again, law enforcement is oftentimes the initiator there, having contact. They're either dispatched to a scene by our 911 center, or they just have contact with somebody or respond. So it's been a focus there to start things like our Crisis Assessment Response Team, our CART team. Also, we trained law enforcement. There was a big initiative across the county, and Mike is a big part of that ongoing training in CIT, which is Crisis Intervention Training for law enforcement across multiple jurisdictions, not just the sheriff's office. But those things have seemingly worked very well. Objective number 2, by to the end of 2024, the percentage of life report community survey respondents who reported not seeing a mental health provider when needed will be less than 20%, and barriers to mental health care will be reduced. Again, the way we influence this at best is through our behavioral health program in North Central Healthcare. I don't think it's not surprising to me. I doubt it's surprising to anyone here. There has been that response isn't where we want it to be. You'll see from the life report data, we still have a number of people that are reporting that they have barriers to mental health or not seeing a mental health provider when they believed it was needed. So North Central's continued to try to bolster their availability and access, but that continues to be a challenge. Lastly, under 3.7, the annual number of deaths by suicide will decrease. And you'll see the numbers there again have remained, I think, there has been I'd classify that as stable or slight uptick perhaps, starting in 2017 with 20, 2018, 25, and you'll see we are ending 2024 at 25. Largely, I would think a strong correlation with the challenge we just talked about with mental health service provision and the indicator above. So that's the data, again, pulled through Marathon County Pulse. Anything you want to add there, Amanda? I know the health department has done a lot with things like the school-based mental health consortium and other public education efforts to impact, to try to mitigate risk of suicide, but that is the data point as it exists right now.
On a quick side note, just so people are aware, so Lance is going through the Marathon County Pulse, which is a great thing you can look at. And another great one to look at is NACO County Explorer. Because what you can do in NACO County Explorer is to see how we're doing compared to other counties in the nation, what they're doing differently than us. There's several things that I've gone through there over the years. I try to bring it up every session. I haven't this time, I don't think, but NACO County Explorer, if you want to just go on NACO, NACO, capital letters, and look under County Explorer, and you can go in there and click on pretty much a lot of data. So they do some of that work for us, and that's something they provide for us being a NACO member. So Marathon County Pulse and NACO County Explorer, some of these numbers you can look up. So, all
right. Thank you, Mr. Chair. The next item that you're identified as a lead committee is Objective 7.2, mitigate the impacts of drug and alcohol abuse in Marathon County through evidence-based practices. You have 3 outcome measures. We'll talk through, again, some of those here. With respect to the first one, by the end of 2024, an outcome measure will be established to measure the quality of life for all people in counseling, mental health, or AODA-related treatment programs seen at North Central Healthcare. And a little background on that, that was added as an outcome measure based on best practice, which had changed. We used to measure things like recidivism or relapse, but with expanding, ever-growing knowledge about the frequency of relapse, their really best practice, as I understand it, is to move towards a quality of life measure, because it's not so much whether or not someone relapses, that's a relatively frequent occurrence. Relapse, you often may hear relapse is a part of recovery. So best practice was to move to creating an outcome measure or implementing an outcome measure on quality of life. I haven't specifically had time to reach out to North Central Healthcare to see if they've done that across their programs. I know that is the goal. They just have really been, like the county, trying to get to a place where they're much more data-driven. So I'll follow up with them on Objective 7.2, outcome measure number 1. With respect to number 2, again, this is Marathon County Pulse information that Amanda was able to pull. Less than 3% of school students in Marathon County will report having taken prescription drugs without a doctor's prescription 1 or more times in the past 30 days. Again, the focus, the desire, setting a stretch goal based on previous life report responses, and you'll see those from 2015 and 2017. Progress, it appears, based on that's my characterization, but you'll see 8% to 11 in 2017, back down 9 in 2019, 7 in 2021, 8 in 2023. As you might imagine, with the challenges that exist in our school system, and kind of some of the things we've confronted as not only a community, but really a country over the last several years, there's been more of a focus on mental health and efforts with children. So I think we've done well there. Anything you want to highlight, Amanda, on that one?
I would just add for this one and for number 3 coming up that we've invested a lot of efforts into certain programs in Marathon County to help bring down the risks of medication abuse, including drug take-back days. Almost all law enforcement centers or departments within the county have drug take-back boxes that are available to residents year-round, not just in April and October. And then also we have a fatal overdose review team, which looks at overdoses and comes up with recommendations for community partners to implement in order to reduce that. And then lastly, our public health vending machines. We've increased naloxone access to Marathon County residents by placing those 2 vending machines and making sure that they're stocked and available for residents when they need it.
Thanks. Great information. And that goes perfectly with the next one, which is again very similar to the suicidality measure before, but the rate of overdose deaths among residents in the county will hold steady or decrease. That's a stretch goal. You've seen in the news just the prevalence of opioids and the potential for overdose deaths. But as Amanda said, we've done a lot of things between the health department and our medical examiner's office with our work on our fatal overdose review teams. I think that's very important, as Amanda said, to give those areas of opportunity, identify those areas of opportunity for community partners, which can also be treatment, right? Like how perhaps you look back and say, what were the areas where we could have intervened, or what if anything, did we miss, or what worked well? All areas there. So you'll see we have had those overdoses kind of certainly go up over the years of 2020 and 2021, but have started to come back down over the last 2. So that takes us through all of the outcome measures that, or objectives rather, with the outcome measures that this committee has identified as a lead. As the vice chair referenced, I don't think, ultimately it's of course up to the county board if there's how you're going to proceed with identifying what your next strategic plan will look like, but always a good practice in my mind to take stock of where you are before you put together that next plan.
Vice Chair Dickinson.
Thank you. I just want to say thank you to Chairman Boots, Administrator Leonard, the department heads for having the discussion. Really, this is the wrap up, putting a bow on this other strategic plan. And as Administrator Leonard had said, when you look at this plan and you figure out, what the next comp plan is going to be and the next strat plan is, I think something that came up yesterday, which is reasonable to bring up today, is are these outcome measures measurable? Is it something we control? And so the discussion for the committee would be, what are the things that we really can take charge of and really can impact, and make those maybe the things that we focus on. But thank you everyone for all the information. I really do appreciate it. Thanks.
Questions for Vice Chair Dickinson or Lance or myself on the strat plan? And I will at some point, Supervisor Dickinson, like to sit down and I guess I want to see what your thought process is on how we're going to do. I know, correct me if I'm wrong, Administrator Leonard, what was it, 2017 when we sat in this room and we had all the comprehensive objectives out there and then we kind of divided them out and we had a survey as well, but like, are we envisioning something similar or do you have anything in mind right now, I guess, is my question? of how we were going to attack this? So that's to Vice Chair Dickinson. So you kind of got, do you have a sign of a plan of what you think how we're going to attack it?
Yeah, at this point, I don't.
Okay.
I think the because we're stepping through the comp plan and making those updates. And then from there, I think when that comp plan gets finalized, which would be next year, the beginning of next year, approved by the county board, then we can, whomever that person is, whether myself as vice chair or someone else, I think we would step through and develop the strategic plan off of that sometime in the middle of next year.
All right, perfect. Just wondered what you had there. So. Anything further for anyone? All right, thanks, Chris.
Thank you.
All right, with that, we will move on to 8. A, committee members are asked to bring ideas for future discussion. What's the status here, Lance, before I do anything with the next one?
I think Aaron is on, but I apologize. I believe we had a plan to tour the community-based outpatient clinic again, attempt 2.0. But Aaron, correct me if I'm wrong, the VA cannot accommodate us today?
Yes, sir. They had some unfortunate things come up working with the new clinic or the clinic in Rapids too. The manager for the area up here is in charge of both. So he had stuff come up. I did schedule with him, and as of right now, we are scheduled for the next Health and Human Services Committee to view the outpatient clinic. I will say that with a caveat that if something changes last minute, I'll try to provide some email update to Administrator Leonard to give the board and committee a heads up.
Thanks,
All right.
Aaron.
Thank you. All right, with that, we'll move on to 8B. So no tour today. So I hope I didn't inconvenience anyone, But anyway, so we'll go to B. Next meeting is Wednesday, April 30th, 2025, 3 o'clock, and number 9. Motion to adjourn and a second. All in favor? Aye. Any opposed? Motion carried. Thank you. Conway and Ron Cavelli.
No, I didn't. I did just see Matt Barnes sent an email.